My name is Erin Johnson and today is the 27th of September 2013. In this video I'll be demonstrating my ability to perform the following airway management tasks safely. The placement of a patient in a lateral position, the triple airway manoeuvre, the safe insertion of an oropharyngeal airway, the safe insertion of a nasopharyngeal airway, the laryngoscopy and the assisted positive pressure ventilation using a bag valve mask. These skills allow the paramedic to inspect the airway and remove any blockages and also create an airway in a patient whose airway is not patent. A common error in the triple airway manoeuvre is forgetting to place a folded blanket or towel. The lateral position is used for stable unconscious patients in recovery. A common error would be to put the wrong knee up, for example this one, and this means that when you roll them over they either roll fully onto their front or they roll backwards back into the position you found them in. So to do it properly, you lift the knee up that's furthest from where you want to roll them, and you put the opposite arm out straight. This arm goes across the chest, and you push the hip and the shoulder and roll them over gently. And then you tilt the head up so any vomit can come out of the airway or liquid, and they're in a recovery position. Under the patient's head, this straightens the airway and allows them to breathe more efficiently, and you can also get a better view. Alright, so you need to tilt the head back with your hands and use a pistol grip to pull the chin out, and that's called the sniffing position. To complete the triple airway manoeuvre, you need to put your fingers behind the angle of the jaw and your thumbs on their face and thrust the jaw upwards and outwards. To measure an oropharyngeal airway, you have to go from the angle of the jaw to the corner of the mouth. And a common error when inserting an OPA is just sticking it right in and not using the twist. This can damage the airway. So to insert it correctly, you have to have it at a 180-degree angle and insert it to the back of the tongue and then twist, and it should go in smoothly. And then you check that you have a seal. A common error in insertion of the nasopharyngeal airway is just sticking it right into the nostril without twisting it as you go. That can cause damage to the nasal passage. The correct way to do it is to lubricate the ends with KY gel, and you find the biggest nostril and tilt the nose up towards the eyes. So biggest nostril, and then you slowly rotate it clockwise and anti-clockwise as you insert it gently. And again, you have to check that you have a correct seal. With a laryngoscopy, a common error is just to stick it right in the mouth without checking that the light bulb is loose or tight. If it falls out in the airway, it may cause further obstacles for you to have to retrieve. So I'm checking that it's tight and it's working, and I use my left hand, and with the laryngoscope I use my right hand to tilt the forehead back, and I put it to the back of the tongue on the right side of the mouth, and then until it hits the molecular groove, and then I sweep it across the back of the tongue to the left side of the mouth, and I pull back until I can view the vocal cords, and that way I'll be able to see whether there are any objects in the airway. And while you're pulling back, you need to make sure that you don't hit the teeth, as they may break. A common error of the bag valve mask is to overventilate the patient. So you squeeze too much air into their lungs, which causes overinflation. To do this correctly, you need to gain a correct seal by using the C grip with your index finger and thumb and placing that around the top of the mask. So you put that over their mouth and nose, and then you put the remaining fingers under the chin to get a good grip. And to determine their tidal volume, which is how much air you'll put into their lungs, you estimate their weight or ask someone their weight, and you times it by 10. So I'm assuming this patient is about 70 kilos, so 70 times 10 is 700 mils. So that's about 1/3 of this bag, which is 2 litres. And and I will ventilate them 12 times a minute, so that's one ventilation every 5 seconds. So I'll just demonstrate that. 2, 3, 4, 5. 2, 3, 4, 5. 2, 3, 4, 5. 2, 3, 4, 5. And all the while I'm looking for the rise and the fall of the